If you're over 60, there's one health number that can rise quietly and change your future without warning: blood pressure. It doesn't always come with pain. It doesn't always come with symptoms. Sometimes it rises while you're sitting on the couch, watching TV, or lying in bed, trying to fall asleep. And the most dangerous part is this: many seniors think high blood pressure is only about salt or genetics. But there's a hidden driver that can tighten your arteries in minutes, even if your diet is pretty good. That hidden driver is your nervous system. When your body senses stress, poor sleep, anxiety, inflammation, dehydration, low magnesium, blood sugar swings, or even chronic pain, it can flip into a mode that squeezes your blood vessels like a fist. Picture your arteries like a garden hose. When the hose is relaxed, water flows easily. But when that hose tightens, when it contracts, pressure builds. Now here's the good news, and it's real physiology, not wishful thinking. Your breathing can talk directly to the nervous system that controls that hose. In this video, you'll learn 3 breathing tricks that many seniors feel working quickly, sometimes within 60 seconds, because they help shift the body out of fight or flight and into rest and digest. And I'm going to teach them like a doctor and nutritionist would. What's happening inside your arteries? Why breathing affects blood pressure? How to do each trick safely? And how to turn this into a daily routine that protects your heart and brain long-term. Important note, this is educational information, not medical treatment. If you have chest pain, severe shortness of breath, fainting, stroke symptoms, or dangerously high readings your doctor warned you about, seek urgent medical care. But if you're a senior who wants a simple, natural, body-based tool, something you can do anywhere, without equipment, then stay with me, because the 3rd breathing trick is the one most people wish they learned years earlier, especially for nighttime blood pressure spikes. Let's begin with the why. The real reason breathing can lower blood pressure so fast. To understand blood pressure, think of 2 forces working together. How hard the heart pumps. How tight the blood vessels are. A lot of people focus only on the heart, but the tightness of the vessels may be just as important. Your blood vessels have muscle in their walls. Those muscles can tighten or relax based on signals from the nervous system, hormones, and inflammation. Now here's the key: your body has 2 main nervous system modes. Mode number 1, sympathetic, fight or flight. This is the survival mode. It raises heart rate, increases stress hormones like adrenaline and cortisol, and tightens blood vessels to push blood to muscles fast. That's helpful if you're running from danger. But if you live in that mode every day, due to stress, poor sleep, chronic inflammation, anxiety, or pain, your vessels can stay tighter than they should. Mode number 2, parasympathetic, rest and digest. This is the healing mode. It slows heart rate, relaxes vessels, improves digestion, and supports deeper sleep. The problem is, many seniors don't spend enough time in this mode. As we age, our blood vessels can become less flexible. And when vessels are less flexible, pressure rises more easily. That's why a stressful moment at 30 might barely affect you. But at 65, it can hit you like a wave. Now, breathing is powerful because it's one of the few bridges between the conscious and automatic body. You can't directly command your arteries to relax, but you can change your breathing pattern. And that sends signals to the brainstem and nervous system that influence vessel tone. Here's the science in simple language. Fast, shallow breathing can tell your body something is wrong. Slow, controlled breathing, especially with longer exhales, can tell your body, we are safe. When your body feels safe, it loosens its grip. Breathing can also influence something called baroreceptors, pressure sensors in the arteries that help regulate blood pressure moment to moment. Slow breathing can improve how this system responds, helping the body regulate pressure more smoothly. So these breathing tricks are not relaxation. They are a direct message to your internal control system. Now let's do the first one, fast, simple, and surprisingly effective. Breathing trick number 1, the pressure reset sigh, fast relief in 60 seconds. This first technique is the one I recommend for sudden spikes of tension. You know that moment Your shoulders rise. Your jaw tightens. Your chest feels slightly tight. Your thoughts speed up. And your body feels on edge. That's not just stress. That's your nervous system shifting toward fight or flight. This technique is sometimes called the physiological sigh, but I'll call it the pressure reset sigh, because that's exactly what it feels like. How to do it, step by step. Sit down. Feet flat on the floor. Back supported if possible. Relax your shoulders away from your ears. Soften your jaw. Unclench your tongue from the roof of your mouth. Inhale through your nose until you're about 70 to 80% full. Not huge. Not forced. Gentle. Without exhaling, take a second short inhale, just a small top off. Like a tiny sip of air. Then exhale slowly through your mouth. Imagine you're fogging a mirror, but softly. That is 1 round. Now do 3 to 6 rounds. What's happening in your body? The lungs contain tiny air sacs called alveoli. That second small inhale can help open them and improve the exchange of oxygen and carbon dioxide. Then the long exhale sends a calming signal through the nervous system. Your heart rate can slow slightly. Your vessels can soften. And pressure may drop. Make it safer for seniors. Do it seated, not standing. Keep the exhale long but comfortable. If you feel dizzy, shorten the exhale slightly and pause normally between rounds. When to use it? Before checking your blood pressure, after you rest. After a stressful phone call. When you feel irritated or anxious. When you wake up at night with a racing mind. After climbing stairs or carrying groceries. And here's a powerful secret. Many people breathe wrong right before they measure blood pressure. They rush, they talk, they move, they hold tension. So their reading looks higher than their true baseline. A simple routine is: sit quietly 5 minutes. Then do 3 rounds of pressure reset sigh. Then measure. Now let's go to the second trick. This one isn't just a quick break. It trains your body into a calmer rhythm, like physical therapy for your nervous system. Breathing trick number 2, 4 inches, 6 out, the artery softener. If blood pressure is partly about vessel tension, then this breathing trick is about teaching the vessels to stop overreacting. It's calm. It's steady. And it's one of the simplest ways to activate the parasympathetic system. Here's the rule. Make your exhale longer than your inhale. How to do it? Inhale through your nose for 4 seconds. Exhale slowly for 6 seconds. That's 1 cycle. Do this for 3 minutes. If you want an easier version, inhale for 3. Exhale for 5. The exact numbers matter less than the principle. Longer exhale equals calmer nervous system. What you should feel. You should not feel like you're struggling for air. You should feel like your chest is softening. Like your body is stepping down from a ledge. If you're forcing it, you're doing too much. What's happening in the body? Slow breathing can improve heart rate variability, which is a marker often linked to a healthier nervous system response. Think of it like this. A calm, flexible heart rhythm usually means the body can adapt without panic. This breathing also reduces the over-breathing pattern that can happen under stress. Make it work even better. Your posture matters. Sit tall, head aligned. Shoulders relaxed. When seniors slump forward, breathing becomes shallow, and shallow breathing can maintain stress signals. Place 1 hand on the belly, 1 on the chest. Belly expands gently on inhale. Belly softens on exhale. This helps shift breathing away from tight upper chest breathing. Best times to practice. Morning, before coffee. Afternoon, when stress accumulates. Evening, 30 minutes before bed. If you do this daily, it's like training your body to stop spiking so easily. Now, the third trick is special, because it helps the exact moment many seniors struggle the most: nighttime pressure, anxiety, and that tight chest feeling. Breathing trick number 3, pursed lip breathing, night calm plus pressure drop. A lot of seniors don't realize this. When you feel anxious, your breathing often becomes short, shallow, and fast, without you noticing. That pattern itself can keep the body in a stressed state. And a stressed state can tighten vessels. Pursed lip breathing is a gentle way to slow down breathing automatically, and it naturally creates a longer exhale. How to do it? Inhale through the nose for 3 to 4 seconds, gentle. Purse your lips like you're slowly blowing out a candle. Exhale for 6 to 8 seconds, soft, controlled. Do this for 2 to 4 minutes. Why seniors love this one? Because it doesn't feel like exercise. It feels like your body is finally releasing tension. It can help calm the chest, slow the heart rhythm, reduce the sensation of air hunger, and support relaxation before sleep. Make it even more effective, doctor tip. During the exhale, imagine you're letting your shoulders melt downward. Many seniors keep shoulder tension without realizing it. And shoulder tension sends a message of brace to the nervous system. When to use it? At bedtime. During anxiety. When you wake up at night. Before a stressful appointment. After a blood pressure scare that makes you nervous. Now, let's talk about a very important piece: why some people try breathing exercises and feel dizzy or worse. This is where we get smart and safe. Safety plus the 7 mistakes that make breathing backfire, especially after 60. Breathing is powerful, but it must be done correctly, especially for seniors. Here are common mistakes and how to avoid them. Mistake number 1: breathing too deep, too aggressively. If you inhale too big and exhale too hard, you can get dizzy or tingly. Why? Because you can lower carbon dioxide too quickly. Carbon dioxide isn't bad. It helps regulate breathing and blood flow. So remember, gentle, not forceful. Mistake number 2: holding the breath. Some breathing methods use breath holds, but for blood pressure calming, we don't need long holds. Holding can create strain in some people and may increase pressure temporarily. Stick to smooth breathing. Mistake number 3: doing it standing when you feel lightheaded. Always sit. If you're unsteady, sit with your back supported. Mistake number 4: trying to fix blood pressure without addressing triggers. Breathing helps, but if you are dehydrated, sleep deprived, highly stressed, consuming too much caffeine, eating ultra-processed salty foods, your pressure may spike more often. We will address the food support in the final section. Mistake number 5: measuring at the wrong time. To get a more accurate reading, don't measure right after eating. Don't measure right after exercise. Don't measure right after coffee. Don't measure while talking. Sit quietly for 5 minutes first. Mistake number 6: tight jaw, clenched fists, crossed legs. These create tension and can influence your reading. Keep feet flat, hands resting, jaw relaxed. Mistake number 7: ignoring warning symptoms. Breathing is not emergency medicine. Seek urgent care if you have chest pain, severe headache with confusion, weakness on one side, slurred speech, fainting, severe shortness of breath. Now, with safety clear, let's take these 3 breathing tricks and build a simple daily routine, and then I'll add the nutritionist layer that makes them work even better. Let's make this simple and real. You now have 3 breathing tools you can use like a personal control panel. 1. Pressure Reset Sigh. Use it when stress hits quickly. 3 to 6 rounds can help calm the nervous system fast. 2. For inches, 6 out breathing. Do it for 3 minutes daily. This is training, your long-term protection. 3. Pursed lip breathing. Use it at night or during anxiety. It's gentle, safe, and calming for the chest. Now, as a nutritionist, here's what makes these work better, because blood pressure is also influenced by hydration, minerals, and inflammation. The blood vessel support checklist. Hydration: sip water through the day. Dehydration thickens blood and increases strain. Potassium foods, leafy greens, beans, avocado, citrus, sweet potato. Potassium helps balance sodium. Magnesium foods, pumpkin seeds, almonds, spinach, beans. Magnesium supports vessel relaxation. Less ultra-processed salt, packaged snacks, instant soups, processed meats. These can stiffen vessels. Sleep protection. Poor sleep raises cortisol, and cortisol can raise pressure. And here's a simple daily routine for seniors. Morning, 3 minutes 4 inches / 6 out breathing. Afternoon, 30 seconds pressure reset sigh, 3 rounds. Night, 2 minutes pursed lip breathing. Small actions. Huge impact over time. Now I want to ask you a simple question that helps the entire community. When does your blood pressure feel worse, morning, afternoon, or night? Type one word in the comments. If this video helped you, please like, subscribe, and share it with someone you love over 60. And if you want the next video, tell me. Do you want 5 foods that naturally relax blood vessels or 3 mistakes that make blood pressure readings look higher than they really are? Your heart deserves calm. And calm can start with one breath.